It's well known that there is a tremendous shortage of available services for individuals suffering from both mental health and substance use disorder. And this is not a phenomenon that is unique to Minnesota or Minneapolis and St. Paul. We see it nationally. Fairview is one of the premier leading healthcare systems in the nation, and it is Acadia's privilege to have the opportunity to work together with Fairview in bringing increased access to mental health services and substance abuse treatment to the greater Minneapolis, St. Paul, and Minnesota region generally. Acadia's philosophy of care really focuses on treating the whole person, mind, body, and spirit, and integrating both behavioral medicine, addiction services with primary medicine, and the continuum of care necessary to improve the health and life of the patients that we serve and their families. I'm very excited about the new hospital. The new hospital is a state-of-the-art designed hospital from the ground up with open spaces, extraordinarily fine finishes, a lot of attention to detail focused on the dignity and the respect of the individual as they walk through the front door of that hospital, seeking help and receiving the care that they need to be able to return to their family, friends, and work. The hospital will have a full gymnasium, recreational activities, spacious group rooms and activity rooms, private therapy consult offices, full cafeteria. We try to create an environment where the individual feels like they're more at home than being in a hospital. The focus of treatment in our behavioral health hospitals and our partner hospitals is on the rapid stabilization of acute symptoms in order to return the person to optimal level of functioning as quickly as possible. It is common that patients with mental illness or substance use disorder issues often have unresolved or unmanaged medical complications. This is often the result of a lack of self-care because the psychiatric components of their illness often impede their ability to engage in self-care. So while we do create an environment that is intended to be more home-like, it also allows us, because it is a hospital, to bring in all of the specialty services necessary to take care of the whole person. And that includes physical medicine as well as their behavioral health and substance use services. This hospital will have full medical services, including primary medicine, physicians, nurse practitioners, and other hospitalist specialists to ensure that we're able to take care of any medical condition that presents that is within the reasonable scope of a behavioral health hospital. We want every patient who needs mental health or substance use disorder services to have access to those services within this hospital, regardless of their ability to pay, their insurance status, or any other factors that might be a barrier to access of care. I think one of the things that excites me the most about the partnership with Fairview, and this draws on the fact that I'm also a clinician, is the intense high degree of innovation and best practices and evidence-based care that Fairview demonstrates on a daily basis. So partnering with Fairview provides an opportunity to bring much needed services at a time when they're needed most.